The patient is placed in the beach-chair position. Acromion, clavicle, coracoid are marked on the body surface.
Make 2 incisions below the anterior lateral edge of acromion and a supraclavicular incision as the picture. Establish the anterosuperior portal ASP and the anteroinferior portal AIP. An ablator is inserted through the ASP, and the soft tissue around coracoid is removed carefully to reveal the base of the coracoid, little by little. Avoid damaging the tendons and ligaments attached to the coracoid. Insert the ablator along the anterior edge of clavicle to the inner side of coracoid. Then review the inner side of the coracoid. The tip of ablator should be directed towards the lateral side of the shoulder and stick to the surface of coracoid. Avoid damaging the neurovascular structures medial to the coracoid. Insert a right angle clamp along the anterior edge of clavicle to the inner edge of coracoid. Detach the tissues bluntly. Put the first PDS2 wire to the bottom of coracoid by the right angle clamp. Then insert a wire grabbing plier into ASP. Pull one end of the PDS2 wire out of ASP. Insert a clamp into the posterior edge of the clavicle, reach the lateral side of coracoid. Then insert a lumbar puncture needle into the ASP to thread another PDS2 wire to the lateral edge of coracoid. Clamp and pull out the end of the second PDS2 wire through supraclavicular incision. Pull 2 PDS2 wires by the wire grabbing plier through the ASP. Make sure that the fiber tape sutures will not be stuck by soft tissue. Tie the end of PDS2 wires with both ends of 2 fiber tape sutures, and then pull out PDS2 wires from supraclavicular incision. Make the fiber tape sutures U-shape around the coracoid. Ensure the fiber tape sutures in the correct position. Then use a big round pin with PDS2 wire to across the subclavian space. Tie the postclavicular part of the PDS2 wire with the preclavicular part of the fiber tape sutures. Then pull out the PDS2 wire from the anterior edge of clavicle so that the fiber tape suture went around the clavicle once. The sutures placing is finished. Now tying the juti knots as follows. Cross the postclavicular part of fiber tape suture and the middle part of fiber tape suture over the clavicle. The postclavicular part of fiber tape suture should be under the middle part of fiber tape suture. Then we tie the both ends of fiber tape suture as a single knot by a clamp. Let the knot between the middle part of fiber tape suture and clavicle. Thus create a self-locking juti knot. Straighten the knot with at least one assistant resetting the acromyoclavicular joint. The middle part of fiber tape suture will press and hold out the knot, which makes the juti knot tighten and tighten. At this time, clamp and lock the knot. Correct reduction confirm with a C-arm. Then, tie several single knots or square knots. Once locking, the knots are stable. Generally, we use 2 fiber tapes, one for imitating conoid ligament, another for imitating trapezoid ligament.